My name is Julia and my story started with shoulder pain and a cough. I was a sort of social smoker and I'd stopped at least 12 years, probably more before, because my son was 12 and then pregnancy and then I probably wasn't going out so much, so probably about 15 years before. It started off, well, probably with a chest infection and I had some antibiotics and that went away, and then I just got cold and cough after cough after cough for the next couple of months. And I had children in primary school at the time, so I was just like, it's just that season. And then that was sort of about October to December time, 2015. And then in the January, I just had this really annoying cough. And I went to the doctors, had some more antibiotics. It didn't clear up. Went back to the doctors, had a chest x-ray. That seemed normal. Had more antibiotics. And I was due actually to go to the doctors again, and I was at work and I was sitting at my desk after lunch, and I just felt really ill and like I had a ton of bricks on my chest. So I went home, my husband come in, and he said, "Oh, good job you're going to the doctors tonight." And I said, "Phone me an ambulance." And I had double pneumonia and ended up in ICU for 8 days. And while I was in ICU, I'd done a sputum test, which was abnormal, and that's what started the testing process. But and I had had a shoulder pain, which I'd obviously thought, oh, I've just slept on that awkwardly. And yeah, I was diagnosed through a CT-guided biopsy. And then I was told I had stage 4 incurable cancer. They didn't know at the time that I had the ROS1 mutation, and I went on the Checkmate trial for 2 years on chemotherapy arm. And luckily for me, I responded really well to chemo, and I was on that for 2 years until my kidneys didn't like it anymore. So I decided, which was really tough, to take a break from chemo. And it was only at that time that my oncologist was looking through my notes and she discovered my ROS1 mutation. So she said, well, this opens up another treatment option for you if and when you need it. So I was stable for a year without treatment, and then after that I went on targeted therapy. Basically taking 1 tablet a day, so it's a lot less invasive than chemo, especially for, when you've got a young family. It's less hospital visits, and that went really well for about 4.5 years. And then last year, out of the blue, it spread to the leptomeningeal area of the brain, which was a bit of a shocker because the lungs were stable and you sort of think, well, how did that happen? So there was no further treatments available for me on the NHS. So my oncologist applied for the lorlatinib drug through Pfizer on compassionate grounds, and it was granted, and it's like, done wonders. There's no evidence of disease on the brain or the lungs at the moment, and that's the first time for the lungs in like 9 years. So yeah, happy with that result. Be persistent, know your body. And if the doctor sort of says, oh, you're young, and I don't know if because I've got quite a rare cancer, it sort of looks like infection, so I don't think my doctor could have done anything more than they did to diagnose me earlier. But listen to your body. You know, if a shoulder pain's going on longer than a month, then you need to get it seen to. And I even know someone who had knee pain and was diagnosed with lung cancer. So, you know, any pain's worth getting checked out.